About 8 out of 10 women get stretch marks during pregnancy. About 7 out of 10 girls and 4 out of 10 boys get stretch marks during puberty. I know we have covered this topic before, but due to public demand, we are repeating it just for you. Ladies and gentlemen, sit back, relax as I talk to a skincare scientist about the causes, treatments, and types of stretch marks. Thank you for joining me right here at Serena Hotel. My name is Serendanu Teshna, and this is the Skin Therapy Show. And once again, welcome to this week's episode of the Skin Therapy Show. I'm your host, Serendanu Teshna. Joining me on set today is John Nelson, a skincare scientist, and Josephine, brand manager at BioOil. Welcome to the show, guys.
Thank you, Sarah, very much indeed.
Really
Thank you.
Nice to have you, John. Welcome to Kenya.
Thank you. Thank you.
Do you like it?
Yeah, I've been here for 24 hours and so far so good. It's really good.
Okay.
And the people have been very, very friendly and I felt very welcome, so thank you.
All right. So before we get to you, let's start with the lady. Josephine, tell us more about yourself, what you do, and how long you've been doing this for.
So thank you again, Sarah. My name is Josephine Mavumbo. I've been in marketing for 3 years now. So currently I'm a brand manager and I handle BioOil.
Oh, nice.
Yeah.
John?
Okay, so Sarah, I was born in the UK. I'm a skincare scientist. I live currently in South Africa. I've lived there the past 20 years. And I consult to a number of companies on conditions of the skin, products, what they do, ingredients, and that type of thing. So it's really a general advisor on skincare. And my first time in Kenya.
Karibu. Welcome.
Thank you.
So, guys, today we are talking about stretch marks and scarring. John, if I can just throw this to you, what is stretch marks and what is scarring?
Okay, so if you look at stretch marks, Sarah, I think the best thing I can do is give you an analogy here. Skin has an elastic property to it. So in other words, if you stretch skin, it will stretch and it will retract. But if you stretch it too far, you will get to a point where the collagen in the skin will not retract. In fact, it will become permanently damaged. And that permanent damage you see is what we know as a stretch mark. Now, the analogy is with a spring. If you take a spring and you pull a spring so far and you let it go, the spring will retract.
Exactly.
If you pull the spring too far, it will become distorted and it will never retract back to its normal position. So you can view a stretch mark, I guess, as an overextension of the skin, which causes these ugly marks that we call stress marks. Now, when does it occur? It occurs when you get expansion of the skin caused by either rapid gain in weight or, of course, during pregnancy when the lady's abdomen area will expand over a period of 9 months. And that is when stretch marks occur. So they're really internal damage caused by overextension of the skin. Scars are a little different. Scars normally occur as a result of physical damage to the skin. So the skin can be cut, for example, and when the skin heals, it'll form a scar. The reason that scars form is because when the skin repairs itself, there are messages going to the brain to say that the skin's been damaged and it must be repaired quickly because the body is at risk with infection and things like that. So you'll find that for a lot of people, the scar tissue, as we call it, has got a different composition to the skin itself, and that's what gives you the appearance of the scar. Some people will suffer from something called keloids, and keloids are when the scar stands above the skin, and that's also a very, very ugly condition.
Is that a scar? Is a keloid a scar?
A keloid is a type of scar. So some people will form keloids. It's to do with the physiology of the individual person and the way the skin repairs itself, but you will find that a relatively small percentage of the population will form keloids when it's a three-dimensional scar. It doesn't just stay two-dimensional on the skin surface, it actually forms a third dimension where it actually gains height and actually looks like a little ridge on the skin.
John, just before we delve too much into the keloids, maybe you can let our viewers understand what a keloid is, because I'm sure someone is watching this show and wondering
what is a keloid? Yeah, okay.
Yeah.
So very simply, Sarah, a keloid is scar tissue which has three dimensions. So most scar tissue you will find occupies 2 dimensions on the skin, but a keloid specifically is a raised scar. So it's a scar that, I guess, if you look at it, looks like a little ridge on the skin, and it can be quite pronounced. Sometimes keloids can be as high as 1 or 2 millimeters off the skin. And of course, that type of scar looks even more distressing than an ordinary 2-dimensional scar. And the propensity, I think, to form a keloid is depending a lot on the genetic response of that. And the hormones, of course, as well. Because what happens when you damage the skin, the brain tells the skin that you've been damaged. and we have skin cells that effectively work overtime. We have a skin cell called the fibroblast, which the viewers needn't remember. We won't test them afterwards. But that's what makes new skin. And what they try to do, they try and make new skin very quickly. And in so doing, the composition of that skin is different often from the composition of the skin around it. And that's why you get a scar.
Josephine, being a brand manager at BioOil, and we know this product is mainly for scars and also stretch marks. According to your own research, why do young people get stretch marks or start noticing the stretch marks and the scarring at puberty?
Just to probably highlight what John has mentioned, you start noticing your stretch marks in puberty because that's the time you get to add a bit of more weight. Like for women, your body figure starts to be more noticeable. So yes, you are growing, your skin is growing and expanding in some areas, not in all areas. So my take on scars and stretch marks is that thing that you cannot prevent, but you can take care of. So that's why we have BioOil, because it's proven to work, formulated to work and help improve the appearance of your scars and stretch marks.
Okay, so what are the most affected areas in the body?
For women, I'd say for women, probably your hips, your breast area, your arms, because that's where you tend to notice more expansion takes place, if I may use that word.
Oh, yeah, sure.
So, yeah.
So I think just one point to make there, I think for the viewers, there's a very definite difference between stretch marks and scars in the sense that a scar is the result of some physical damage.
Yes.
Okay, whereas a stretch mark is not. A stretch mark is caused by expansion of the skin too rapidly so that the skin cannot compensate for the amount that it's being stretched. And stretch marks are indeed preventable. Scars generally are not preventable because they are as a result of a physical damage to the skin. So if I cut my finger or my hand with a knife, for example, and I get a scar formed, then the only way of preventing that would be to be more careful with a knife. But with a stretch mark, it is possible to a large degree to prevent stretch marks actually forming before they form.
Speaking of which, just take us through ways in which one can prevent stretch marks.
So if you think, Sarah, that the stretch mark is caused by overextension of the skin, in other words, the skin not being elastic enough. So what we do know is we know that oil products, oil-based products, of which this is one that we're talking about now, if we use them before we get the expansion of the skin, we will see the skin becomes more pliable and more elastic. And therefore, one can stretch it more than one otherwise could before a stretch mark will form. So it's possible to take, for example, a lady who is expecting a baby. If she were to apply this product, which Joe's already said works for stretch marks, if she was to apply that product in the second trimester during the course of the pregnancy, then there's a very, very high chance that she will prevent the formation of stretch marks which otherwise would have occurred had she not applied the product. So prevention in this case is definitely better than cure.
All right. So what about a teenager, someone who's going through puberty? How does one prevent stretch marks? Do you still start using the
Yep, the same thing. I mean, it's a question really. I don't think, one thing we should say about stretch marks, it tends to happen more often in females than males. That is because there are more opportunities during the development of the female body for a stretch mark to occur. So breast development, hip development, those sorts of things. For a male, unless they're putting on weight at a very alarming rate, and that's the most obvious cause of male stretch marks, then you won't find men suffer from stretch marks in the same way that women do. But getting back to your question about teenagers, it's all about the teenager understanding her body, perhaps being guided by the parent, if the parent knows, because sometimes bear in mind these things start to happen at the age of 13 and 14, sometimes younger, when perhaps the female is not totally aware of the physiology of her body. And by the time they are aware of it, maybe the expansion's occurred, maybe it's too late.
Some don't even know what is happening to them.
Exactly. So it's, I think, in terms of a young person, of a young teenager, it's about parental guidance, assuming that the mother would know, because the father would never do it, obviously, and understanding. It's really about understanding when is my skin going to expand beyond its normal elastic limit, and that's when a stretch mark occurs.
Okay. Are you trying to say that BioOil completely removes the stretch
No.
marks?
I am saying it improves the appearance.
Exactly.
Because no product that you apply topically can actually claim to remove a stretch mark. For that face, you probably need to do laser. But in terms of improving the appearance, that's why ladies put on makeup, because you want to improve your appearance, not necessarily change your whole.
Exactly.
Yeah.
Exactly. So it is something that you have to deal with it maybe for the rest of your life.
Yeah, I think what's important here, Sarah, is that for a stretch mark, it is preventable, largely preventable. So really the strong advice I would give your viewers, and we've said it a moment ago, is really to make sure that you use the product in advance of any possibility of a stretch mark forming. You may not eliminate them completely because some skin types are more prone to stretch mark formation than others, but you will certainly reduce the amount of stretch marks that will form.
Okay, John, we will take a short commercial break and
Okay.
then we will come back and discuss the types of treatments that we have for
Fantastic.
scars and stretch marks, all right?
Thanks, Sarah.
Do not go too far. We'll be right back after this short commercial break.